This week on Empowering Midlife Wellness, I'm talking about a really popular procedure that women our age are asking about, and that is a mid-facelift. Let's learn all about it today. Hi friends, and welcome to this week's episode. If you're just joining me, I'm Dr. Susan. I'm a board-certified gynecologist and certified menopause practitioner dedicated to helping women in midlife. Women just like me who want to feel great now and also feel great as we age. Well, this week I'm sharing all about a very popular procedure that women our age are talking about, and that is a mid-facelift. There are different kinds of facelift, but this particular procedure is appropriate for women perhaps in our late 40s or 50s who need something a little bit more natural than the full facelift that an older patient might request. Keep in mind, we don't need any of these things, right? These are just options, and it's good to learn about them so that you can be knowledgeable and then you can make an educated decision, or you can understand the decisions that other people make. Well, how do I know so much about this? Well, I just had this surgery done. And if you've been following me, you might think I don't look any different. I really don't. It's very subtle, but you'll see in the video coming up that it did really make a change for me that I appreciate. I'm very happy with the results, and I want to share this with you just to learn what you could choose to do if you wanted to. So I'm going to be sharing the whole journey from my discussion with my surgeon before the surgery, pre-op, in the operating room. Now, there are surgical photos in this video, so if you are queasy or don't like those, please don't watch the rest of this or turn your head at the appropriate time, because I am going to show you what it looks like in the operating room with the incision open, so keep that in mind, or just fast forward through it if that isn't to your liking. And then we're going to talk about why some patients might choose to do this, things to look out for, how to choose a surgeon, what's the recovery like, all the questions that you could ever ask. We're going to answer those today. Here we go on my journey. Hi friends, so I'm here with my good friend, Dr. Fred Aguilar. Now, Fred and I have known each other for more than 20 years, right?
More than that.
Yeah, a long time, since back when I was a resident. So I'm here talking to Fred about different types of facelift. So I'm considering having this done myself. So I want to ask you, Fred, I'm 57 years old. Who would be a good candidate for this type of procedure?
Usually anyone whose genetics are bad, that have caused their skin to lose elasticity. So sometimes even 49 to 46 might be a good age to do it. Mm-hmm. So your elasticity has held up fairly well, maybe thanks to your rigorous exercise schedule.
And hormones.
And hormones.
Right.
But more importantly, it all happens, or sometimes it all seems to happen all at once, but it's a gradual process. But again, based on whose genetics you're bringing, mom or dad's, or the combination of the two, it starts to age faster. But definitely over 55, you're going to start to see the aging changes due to gravity.
That's right. And so I've noticed, I've been doing Botox for, I don't know, since I was 40. Mm-hmm. So the upper part of my face is looking pretty good, but below my eyes, things are starting to sag, so that even now when I smile, even though my crow's feet are paralyzed, that skin's coming up from underneath.
Correct.
So I think a lot of our patients see that same thing where the top looks pretty good, but below it's starting to suffer. So is that something you commonly see?
Right. And if you just look toward the camera, you know, when we smile, the cheek gets thrown up by the smile muscles, so it hits the skin, which due to aging has descended. So when we're going to do this procedure, we're going to lift the skin back up and bring the cheek pad. So now when you smile, you see there's no crow's feet wrinkles forming, because the cheek is getting thrown up to skin that's now been elevated and put back where it should have been 15 years ago. And when I release it, you can see the wrinkles come right back, and you smile and there they are.
That's right.
So remember that an eyebrow, a youthful eyebrow, is horizontal. So when we're doing this, we're making the eyebrow more horizontal, which is a more youthful look. And when we're bringing this cheek pad up, when you were 18, this little triangle of skin, which is the mid-face, it used to go straight across. And I'm putting it in that position right now. And you can see that the lower eyelid is shorter. So when you were 18, you had a 9 millimeter lower eyelid. And as aging has taken place, this triangle has fallen. And now you have a 15 millimeter lower eyelid. So the beautiful thing about this surgery is that we're going to raise the temporal skin back up where it was 15 years ago. We're going to raise the cheek pad back up. You're going to get a smaller, shorter lower eyelid, so we're going to take the extra skin off of there, and then we're going to tighten the side of the face beautifully as well, so your jawline will stand out and you'll look more youthful all the way across. And we're going to do that on both sides.
Yeah, so ladies, if you're thinking about having this done, I've been standing in the mirror going like this, and it makes a subtle difference. Now, I've had friends who've had this done, and I truly didn't know they'd had this surgery. I just noticed that they looked great, maybe looked rusted. So tell me about that. If I had this done when I was 70, I'd have a different procedure, right? And I would look dramatically different, so it would be very noticeable.
Well, I think the best answer to that is that whenever you get it done, we're going to give you 15 years back. So let's assume you're 60 and you get it done. If you had an identical twin, when we're finished with you and your identical twin did not do it, you would look 45 and she would continue to look 60. And 10 more years, you'd look 55 and she'd look 80.
Yeah, that's a fun thought.
It reverses the aging and puts the tissues back where they were when you were younger.
I like the idea of looking 42. But one of the things that I love about what you do is if we do this when we're, say, 50 to 60, what I've experienced looking at friends who've done this is it's not such a noticeable change that everyone will know you've had a facelift. In fact, they won't know you've had anything. They'll just know that you look better. So rather than waiting, tell me about doing it when you're younger.
Well, interestingly, I did my daughter about 2 years ago, and she was 41 at the time because she inherited the bad side of the genetics of our family. So she had some bags in her lower eyelids, and she was drooping earlier than she should have. So she went back and had it done, and now she looks like in her late 30s, late 30s actually. But the important thing at any age group is that we bring the cheek pad back up, because that is where the aging has happened. This triangle of skin, and again, this is very instructional for your viewers, the face ages in an arc, rotating this way, because everything in the middle is supported by bone. So this cheek pad has rotated in a curve, in an arc, like I said, and so we're reversing that by putting it back up there. So that's important in getting a more youthful look.
Yeah, it's really interesting, the signs of aging when we look at people and try to guess their age. Even someone very healthy like me, obviously I look close to my age of 57, even though I like to think I look younger, because this is something unavoidable despite the fact that I exercise, I've used Botox, I do all the healthy things. So there are different types of facelift. Like, what do you call this?
Well, believe it or not, in this area, it's going to be a fairly normal SMAS facelift. In this area up here, we're actually going to be going deep plane to help this lift even more. And a deep plane means that we're going beyond the normal parameters of the old SMAS facelifts.
What's a SMAS?
Submuscular aponeurotic system.
Okay.
And that's the fascia immediately below the skin that we're actually putting sutures in to elevate. So by going a little deeper up in here, we can actually effectuate a bigger change. So again, the skin just comes along for the ride. You're not going to look over pulled, but we're going to get movement at a deeper level, which will correct the problem.
Now, Fred had mentioned to me earlier that when we lift the skin up, obviously it's going to come up under the eye, so there's an additional incision under the eyes, I think, right?
Correct, because we're going to have, because when we bring this cheek pad up, now the eyes have that extra skin and there's nowhere for it to go, because we've now made your eyelids shorter. So in retrospect, they now look like they're 15 millimeters long, and when we get done, we're going to be back up at 9 or 10. And it's going to make you look more youthful, because your eyes actually give away your age more than your face.
That's right. So we'll have invisible incisions under the eyes, and then others that go around the ear. Now, in a different patient who was, say, 75 or older, I think there's a what we call a full facelift, right? Where that includes the forehead.
Forehead and underneath the neck and all of that, right? So that's, you don't need that yet, but you're getting close. But all of us eventually will get there. But again, I think doing for you what we're going to do is going to make you look more youthful when you present yourself to the public. People will look at you and go, wow, you look rested, and the downtime is quick.
So let's talk about that, yeah.
Yeah, you're only going to be down essentially 5 days for the immediate post-operative period. All the sutures will come out on the 5th day after surgery, and then I just want you to take the next week and take it easy. But believe it or not, the very next day after surgery, you'll be able to get in the shower, shampoo your hair, blow it dry, and act natural.
Yeah, that's really amazing. And I've seen friends of mine who've been through this, and that really was the case, that even
Yes.
2 days later, they may have some mild bruising, perhaps a little swelling, but felt pretty good and looked relatively normal. So this is not something where you've got to be out for 6 weeks and hiding in your home or anything like that.
That's correct. You'll be really pleasantly surprised, and I hope if you do a video afterwards, people are going to be able to notice the difference.
Well, we definitely will do that. And then, Fred, I want to talk a little bit about you. If you're looking for a surgeon to operate on your face, I would not let anyone but you operate on my
thank
face.
you.
And I want to just brag on you a little bit, and this
Thank
is
you.
someone that you want to look for if you're considering this, because your face is your personality, right? I mean, if that gets messed up, that things are
Right.
not good. So what would you look for in a surgeon? And please tell us what your credentials are, because they're quite impressive.
Thank you. I'm one of the few people, it's not as rare anymore as it used to be, but I'm triple board certified in ENT, which is ear, nose, and throat, facial plastic surgery, and body plastic surgery. So on any given patient, I can be operating on the face and the body, and I'm able to contribute a lot. So I just want to make sure that your viewers check out the doctor that you're going to. Make sure they have the proper board certification. There are some boards out there that are not sanctioned by the American Board of Medical Examiners, and I think that that's really important, that you get someone that is properly board certified.
So what's
and
the
not just a fly-by-night board.
what's the proper board certification for a facial plastic surgeon?
Well, it's the American Academy of Facial Plastic Surgery. There's the American Board of Plastic Surgery, which is for the body and face as well, and then there's the American Board of Otolaryngology. So those
Right.
are the three big boards that are important.
So suffice to say, Fred's got plenty of experience, and I think as a surgeon myself, that is critical. And I've looked at before and after pictures. I've seen friends who've had surgery with Fred before. So this is something you want to look into very seriously. You don't want to go with the least
Right.
expensive or the easiest to get into, but someone who's really going to take good care of you and minimize your risks and everything
Right.
that Fred is talking about in millimeters. I mean, this is someone very experienced that I trust with my face. So
Thank you.
what else would you have to tell viewers about what to look for
Well,
if they're considering this procedure?
Just when you lay down on a bed and you hold the mirror up, what the gravity is doing to your face when you're laying down on the bed and holding up the mirror is what we're actually doing right now to you. So if you lay down and you look at the mirror above you and you see that the cheekbones are higher, that means that you need the surgery, because you've already got the laxity, that we can actually improve the positioning of that fat pad.
Yeah.
So just pay attention and then spend some time with your plastic surgeon in a consult.
Now, I do want to mention that I talk a lot about loving yourself as you are and that you're beautiful already, and that is all true. So this is not a surgery that's going to elevate your depression or fix your relationships. I'm not doing it because I think I'm ugly when I look in the mirror. I mean, for me, it's really just about confidence and
Right.
looking good in photographs and putting my best foot forward so I can interact with the world from a more confident space.
Right.
Is that what you
And-
see with your patients?
Absolutely, and looking more rested. And I like to say, very close to what you like to say, there's good vanity and there's bad vanity. Good vanity is the kind of vanity that allows us to take proper care of ourselves. We get up in the morning, we comb our hair, we brush our teeth, we put on good clothes, we make sure that we're ready to face the public. And to me, that's the mark of a good person that wants to look better. And I think that's a good vanity. It's not someone that's over the top crazy about what they're trying to achieve. And I think that good vanity is what's led us here for you. You want to look more open. You want to look more rested. And
Yeah.
this is the kind of procedure that is a very quick recovery and can accomplish those goals and put you in a better position to go forth and enjoy your work and meet the public.
Yeah, and I love that anything that we're doing that improves confidence in a healthy way, whether it's putting on a nice dress, fixing your hair, going to the gym, taking a bath, getting a little something done to treat yourself, if it's safe and it's done appropriately, and we're doing the minimal that we need. There's a
Right.
lot more Fred could do, and we're not doing all of that. We're just doing the least.
That's correct.
If it's something that you're interested in, I think it's something to consider, and not to judge people that make these decisions, but to embrace it if it's something that you want. So we're going to be following this journey through the surgery and post-op. So thank you so much
My
for
pleasure.
talking to me, Fred, and for being my surgeon. I trust you 100%.
Thank you.
We're doing this on Monday, which is about 3 days from now. So look forward to seeing you there.
Thank you very much.
Okay, it's the day of surgery. I'm here with Dr. Fred Aguilar.
Good morning.
So what do we do first, Fred?
We're going to do some markings in preparation for your surgery, and it
Okay.
should go well. And really, just we're all set.
I'm excited.
So let's do some markings.
Okay.
Sit up straight for me. Just you're doing great. So we're going to make them in the hairline here. Come down in front of your ear, right behind the tragus there, and around. Stop right there. I'm going to make a little mark here because this is my no-go area for you, so we don't hit the nerve. And then do a little mark here.
So Fred, if this was not done properly by someone like you, there's a lot of things can happen, right? We've got nerves in our face that control our facial movement and sensation. So what are the things that you think about to be really careful about?
Well, we want to make sure that we don't injure any of the nerves to your face. We don't injure any of the nerves to the forehead, which is the big nerve that runs right through here. So we just want to make sure that we do that properly. And then we know that we're going to undermine the face and bring the cheek pads up, and then do a nice mark on the lower lids. Please look up to the ceiling for just a moment. All right, we're all set. Thank you. And right there, show that again. All right. Thank you.
Okay, well, I realize this looks kind of funny, but I actually feel great. I've got this head bandage on that's putting pressure on the incisions in my hairline on the side. And then Dr. Aguilar wanted me to put ice packs right under my eyes. It's pretty hard to keep ice packs under your eyes, so I'm actually using my multi-purpose silk eye mask to hold them on, and that way I can watch TV. So I think this is pretty creative. I'm going to pack that one down there a little bit more. So little Ziploc bags with ice, tied on with a silk sleep mask, and I'm good to go. I have no pain. I feel absolutely fine. Hey friends, very happy to report this is about 24 hours after my mid-facelift with Dr. Aguilar. I have zero pain, absolutely none. I've got this incision right in front of my ear. You can't even see. One in my hairline you also cannot see. And then tiny little stitches under my eyes, which is where that bruising is coming from. Doesn't hurt at all. That should be gone in a few days. So with some glasses on, I can even go outside and walk around. No one would even know I've had anything done. Hey friends, so now we are day 3 after my surgery. Surgery was on Monday. It's now Thursday. This is the first day I put a little bit of makeup on because I'm going out to lunch with a friend. The stitches under my eyes are going to come out on Saturday. You can't even really see them when I put glasses on, but still a bit swollen, but I don't know, pretty amazing. Hey, now post-op day 5 after my facelift. I got the stitches out from under my eyes this morning. Not wearing any makeup, just a little bit of sunscreen. Feels great, no pain. Taking the dog for a walk. It's pretty easy. Be back at work on Monday. Okay, I'm 1 week post-op, and my nurse practitioner Brandy is taking out the stitches. I can't feel anything. It doesn't hurt. These are obviously hidden in the hairline. I had a little stitch under my eye, which I took out 2 days ago. Normally Dr. Aguilar would do this for you, but since I'm a doctor, don't have to bother him. So once these are out, I'm gonna be back to normal. I can already wash my hair, I can dry my hair. But this is the last little annoying thing, and this is only 1 week out. Okay, well, tomorrow will be 3 weeks after my facelift with Dr. Aguilar. Just a little bit of makeup on. Pretty much can't see those scars near my ears anymore. Little lines under my eyes. I'm not wearing any concealer or anything right now. Been back to normal exercise for 2 weeks. Hasn't hurt pretty much ever. It was a little swollen the first 2 weeks, but it was so easy and kind of forgotten now, honestly, when I look in the mirror. I just feel like I look like myself. Just a little bit of a change. People don't ask me, did you have something done? But a few people have said something like, wow, you look great, or something like that. So yeah, I'm really glad I did it. I'm gonna have my visit with Dr. Aguilar next week, a month after the surgery. Make sure that he agrees that everything looks great, but pretty happy. Well, Fred, it's been about 2 months since my lower facelift.
Right.
I could not be happier. The viewers have seen this whole progression since when we first met in your office, including in the surgery and then each week afterwards.
Right.
So I had a really uncomplicated course. As people know, I had pretty much no pain. I was back to exercising in 5 days, which he said was fine. We'll talk about that. Looked normal within a week, maybe a little swelling. Is that unusual? Was I just really lucky, or?
I would say that it's the technique that we use and the knowledge of how we're going to use local anesthetic before we even start the case. It has to do with the right plane at which we approach our surgeries. All of that comes into play. And then your genetics is a big factor, and you're healthy and you exercise and your healing just went spectacularly well. So it's a combination of things.
Now, that being said, I didn't bruise much, just a tiny bit under the eyes. We saw some video from during the surgery, and it looked like there was really no bleeding. You guys are meticulous with controlling bleeding, so obviously that's very important.
It is very important. Again, it had to do with the way that we use the local anesthetic to our benefit and yours. And then the correction of the creation, I want to say, of the right plane is really important. So there's an avascular plane that we can work in. And all of that leads to a good end result.
Which is really amazing because I have a scar that you can't see at all, and I can't even see it in my hairline, around my ear, under the eyes, imperceptible, even with my hair in a ponytail. I mean, and this is just a short time afterwards.
Right.
So I had the impression, as many of you might, that when you have a facelift, you're kind of out for weeks. Like in the old days, you'd be at home, bruised, hiding out from society for weeks, and this is just not the case.
Not the case, and you can tell them again, you were exercising, what, day
5,
6 or
6,
7
yeah.
after surgery, running?
Yeah, I'll say 5 because he said that was okay. The reason why, Fred, is because, as you guys saw in the beginning, I had a little suture under my eyes that came out on day 5, so he said, please don't run till after it comes out, and I was very good. But right after that, I did go running, and I felt fine. I didn't push it. I wasn't doing anything that was against the rules.
Correct. And again, it has to do with the skill that we bring to the table for you and the amount of knowledge that we bring on where is the right place to make these incisions and to help you heal properly.
So I'm one person. I can tell you I've had countless patients have this done with Dr. Aguilar, which is why I chose you. So this is what one might expect when you have this surgery in really good hands. So we talked in the beginning about the importance of choosing a really good surgeon because this is your face, and we have nerves here that control our facial movement, our eating, our smiling, our blinking. I mean, everything.
Right. When we do a facelift, we do not want to hurt the nerves of the face. And we want to make sure that you can still blink, close your eyes, smile in the correct way that you were smiling before. Right. That's why a lot of people sometimes think, well, with my facelift, I won't need Botox anymore. Well, that's wrong because we are not going to hurt the nerves, and so we want the nerves to function.
Right.
So sometime after your facelift, you will be back on a Botox regimen to stop the muscles from moving the way we want them to stop moving, not because of an accident during the surgery.
Right, and we don't want that frozen face look. I really enjoy being able to raise my eyebrows and smile and have expression. And
exactly.
As a result of having expression, you know, we're still going to have a few crow's feet and normal things, but if we try to eradicate that completely, that gets that really frozen and natural look.
Right, exactly. And again, we need to just revisit for a moment that even if we did a whole facelift, including the neck and the upper forehead and the eyes, the recovery is still 5 days in our hands. And that is an incredible recovery time. And you're right, to be able to get out and run, or I let people use the treadmill at first anyway on day 5 and 6 routinely, because they all do very well.
And this exercise thing is so important. Half of the education that I give is about the importance of exercise and strength training, especially as we get older. So I can tell you, if there were elective surgery and I was required to be out for weeks, I wouldn't do it. I mean, because the detriment to my body long term would just be unacceptable. We have bone loss, muscle loss, and that can be permanent at our age. So unless I have some life-threatening condition, I do not want to be out for weeks. So this is
Correct.
really amazing that you can do something and get back to working out so quickly.
Exactly, exactly. And again, the importance for you, a dedicated triathlete,
I wouldn't have
doing
done
all
it.
these things, you would have said never mind.
That's right.
But because the recovery is quick and because you can get back to exercise and not lose the muscle memory of exercising, the muscle mass that you've developed, the ability to go run 5 miles and not feel like you've taken 16 weeks off, that's a big deal.
That is a big deal. Now, we elected to do the lower facelift, right? Under the eye.
It's really called a mid-facelift
Okay.
because we didn't go to the neck. So we did the middle part of the face and the temporal part of the face and the eyes.
Yes, so I elected not to do the neck lift. Now, that is something I might do at another date. So every patient's different, right? We were talking earlier today about different ways this surgery can be put together, and it sounds like it's very individualized. Like some patients need both, some patients need part.
Right, and I think it's really important. I almost always have the conversation with patients about the congruity of the face. If you're really a lot older and you only do the upper part of the face and you don't do the neck, you're going to have what I call an incongruity. The upper part will look like you're 40 or 50,
Right.
but the neck will still make you look like you're 68 to 75. And most people don't want that. Now, you're not in the 70s or 80s group, so there are people that are in that range that just need one or the other done because of the genetics. Maybe their neck skin is really loose while their face looks great. So the answer is yes, we can specialize it. We can just do the neck on someone. And then we can come back and do the rest of the face 5 to 10 years later when its demands are necessary.
So one of the many things I love about Dr. Aguilar is that you could have done a lot more. I mean, there are surgeons, and understandably, who would have said, Susan, we can do your neck, we could do brow, you could do some other things. And we didn't have that conversation. He really said, and I'll just say, Fred said, just do the least. You don't need that right now. And I love that. I can trust you to be very honest. You don't oversell. You're not trying to do more surgery than I need. Because I'm really glad I didn't do more.
Right.
Right now. One of the reasons, we can talk about this, when you have a neck lift, those of us who swim, for a few weeks, you can't turn your head. And so I wasn't prepared to take a few weeks off swimming. So decided not to do it. So these are all very subtle things that might make one patient's needs different than another.
Absolutely right. And again, I want to again emphasize the importance of going to a board-certified plastic surgeon and making sure that who you go to knows and has the proper training to handle the problems that may arise in anybody's hands as possible. But people that are well-trained and properly trained, we have a lot lower incidence of complications. And we're better able to handle the complications should it arise. But in your case, no complications. Everything went swimmingly well, no pun intended.
Yeah.
And it just worked out great for you, and I'm thrilled.
Yeah, well, I am also, and just to speak to that, surgery has potential risk. Any surgery does. And so, of course, I signed a very extensive consent form that your office appropriately provides that lists all the things that could happen. Now, I'm blessed that none of those things did happen, but it's also important to go into surgery understanding there is a small risk, and very important what you said, that risk for any surgeon is dramatically lower with experience. So I'm just going to add, not just a board certified plastic surgeon, that's great, but someone who does face, because this is your face.
Right.
I mean, if I have my breasts done and one's a little different than the other, not ideal, but I can live with it. But if your face is asymmetric or you have a droop on one side, I mean, these are really
that's not good.
No,
We would be
really
unhappy.
terrible problems.
You're right.
So yet I didn't have any of those. So one of my favorite parts about this was the under the eye, which we talked about this earlier in the video. When you're lifting all the skin up, I mean, that skin's got to go somewhere, and so some of it's removed under the eye. But as a result, my eyes look bigger and brighter.
More open and
Right.
more rested.
Yeah.
And it is amazing how much, as we age, fat pockets accumulate in the lower eyelids, and we see that a lot. So when we take out the fat, only what you'll give us, because you still need the fat in your eye to act as a cushion. But the part that's bulging we remove, and then we take away a little bit of skin that you're going to give us, 2 millimeters, 3 millimeters. Occasionally I get more in some older men and older women who have a lot of loose skin. But we just take what your body will give us so that we don't overdo the lower eyelids. But it does look natural. It does look brighter because now you don't have the skin pooling at the bottom and you're not absorbing light. You don't see those dark circles that everybody hates. And that's one of the reasons why the extra skin pools down there. It's got a lot of oil, so it absorbs light, so you see a darker circle.
I have a lot of patients. Frankly, I wasn't so concerned with under the eye. That was sort of an extra benefit. I personally was more interested in this, but afterwards, I love the under the eye part. But if you're someone who has that little bulge under the eye, and you know many people do. I have many patients who really are frustrated by that little fat pad under the eye. What if you just did that? I mean, because I can tell you, I didn't even feel that. It was so easy. I mean, that's super, super easy.
We do that all the time. We can just do the lower eyelids and let people go. And that is, again, for a specific category of patient. And my job as a plastic surgeon, when you come to me for a consult, will tell you, yes, that's the right surgery for you, or no, it's not. And by the way, that's one of the things that I'm proudest of for me. I tell a lot of patients no. They want more filler here. They want more of this and there. And then I'm not afraid to say no. It's not going to look natural. And so when you come to me, whether you use me or not, at least I'll be honest and tell you up front, you're a good candidate for this, you're not a good candidate for that.
Yeah, that's so important.
And I think that's important.
So important. I'm obsessed with this under the eye thing, as you can tell. So if you just did that, I had a suture that came out in 5 days. The recovery from that, I mean, really this no pain. Now, I had a bit of like a mild headache here, but if I hadn't had that incision, I don't think I would have even noticed the under the eyes, honestly.
You probably wouldn't have.
Nothing. I took, Dr. Aguilar prescribed me some non-narcotic pain pills just in case. I took one of them, which I didn't even need. That's all I took, and then it was Tylenol, and then I didn't even have Tylenol. It was just unbelievable how.
Yeah, isn't it amazing?
Amazing.
And so here we are talking about how nice your result was and how quickly you recovered. And that's sort of contrary to what a lot of people are putting out there, that, oh, you need a lot of time to recover, and you can't do anything. So please take this to heart and realize that in the proper hands, if done carefully, correctly, you can get right back to life. And that's why you're doing this.
That's right. And look pretty natural. Now, some people might say, well, if nobody notices the difference, why would you bother doing it? It's subtle. I don't want someone to be like, whoa, what did you do to your face? The subtlety is really what I love, because, you know, like my mom wouldn't notice, my neighbors wouldn't notice. They just think I look good.
Right. And,
right.
and again, we're talking again about the issue of good vanity and bad vanity. I think you and I have talked about that in the past. And the people that are bad vanity, you know, are so obsessed by making sure that they get that cat eye look, or they want the surgery pulled so tight that everyone can see what they had done. Well, that's not a natural result. That is a fabricated result made to do something for that person that is a little bit on the fanatical side of vanity, meaning they want something that's not natural. And our job is to make you look more youthful by creating a natural you, making it look like it was you 15 to 20 years ago. And I think that that is the epitome of plastic surgery.
Yeah, I couldn't have said it better. I'll tell you, you might have noticed this too. When I see a woman who's had that different kind of surgery, where maybe she's 70 and had everything pulled tight, she doesn't look 50. She looks like a 70-year-old who had a facelift. And I don't think it even does restore youth, but it just looks like you sort of tried too hard. So that's my opinion, no judgment if that's what you choose to do. But for those of you who prefer a more natural look, this is what we're offering.
I like how you said that. Yeah, that's a very good analogy. Very good.
Doesn't make you look younger. So really been great experience. I can't thank you enough, Fred,
I'm so happy
for doing this with me. And it's been fun to share it with you all too. I'm obviously not ashamed I've had this done. I'm proud of it. I'm happy to share that if you want this done, you know, there's a way to do it. So we'll put the information below of how to reach Dr. Aguilar if you wanted to talk to him about that. And if you do choose someone locally and wherever you live, make sure they have similar qualifications, and then you can have this type of outcome. So thank you so much again, Fred.
My pleasure, Susan. Thank you.
And if you enjoyed this episode, don't forget to subscribe. Please share it with your friends. I can't wait to see you next week.